come back to life, and that's because of Adventist Rehab.
I felt as though I'm in a place that's going to give me help.
Cuando llegué aquí,
When I arrived here, for me, it was positive. I could see I was going to get better because of how they treated
la
me.
forma de cómo me trataron.
I think they helped me get back to life just by giving me the tools to be able to help myself.
And they're always encouraging, saying you can, and when you think you can't, they'll give you a way that, well, they'll say, try this or try that.
They want to know about you, and you get the sense that they really care about you.
It builds your confidence. They'll talk to you. They'll reassure you. That's what you need.
There's a feeling of hope in the air.
It's a beautiful facility. It's new, it's clean, it's bright, and it's enjoyable not only to work in, but I think as for a patient, it would be a place where I would want to come.
Adventist Rehabilitation Hospital Tacoma Park is actually located inside of Washington Adventist Hospital. That's a tremendous advantage to us because if a patient has an urgent care need, we have the staff and support readily available to us right here.
What is very unique about those in rehabilitation, especially here at Adventist Rehab, is that each one of them comes with their own sense of mission, and they bring that to the job and into each individual case.
Each of our therapists here believe that it's a privilege to be able to walk alongside our patients and to help them on to the next level of care.
September 21st, 2005, I was helping a friend build a post and beam barn. And in that process, I fell through a hole in the floor.
I came here December 3rd with a small stroke in the left side.
I was a patient here a couple of years ago, and I had my right leg amputated.
I had ruptured appendix, was septic, spent 5 weeks in a coma.
The patients that we see here at the hospital are those who have gone through changes that have affected them physically, such as those that happened after a stroke, as well as those who have had amputations, spinal cord injury, where they may not be able to move their arms or legs, and then those who have had brain injury, where they have a combination of those physical and cognitive impairments or difficulties.
We have occupational therapy, physical therapy, speech therapy. Our medical director is a physical medicine and rehabilitation physician. We have nurses who are rehab nurses. So we all come with an expertise in rehabilitation, but we all look at the patient in different ways. We all look at different angles, and I think that's what's great about our facility.
The ultimate goal is to get the patients back to life and to get the patients to their highest level of function, whatever that may be.
Your goals are the things that you want to achieve. Achieve by tomorrow, achieve by next week, achieve by next year.
I was determined that I just wanted to move as quickly as I could to get back to my family and get back to my life.
The one thing that I wanted to do when I came here is just to be able to stay independent, which they enabled me to do. I didn't want anybody to dress me or do anything for me. I wanted to stay there and to learn how to walk again on a right prosthesis.
Physical therapy dealt primarily with me trying to learn to walk again.
Speech therapy. I thought I spoke fine, but it isn't dealing with that at all. It's dealing with long and short-term memory.
I remember the physical therapist coming in to talk to me, starting to teach me how to bring my legs around and how to push up so I could get myself just to the edge of the bed.
We have several innovative programs here at Adventist Rehab Hospital that we're really excited about.
It feels okay. Feels like I'm standing.
The secret for each person is different than it is for the person before them.
One of the more interesting and innovative pieces of equipment that we have is called the Light Gate, and it's a piece of equipment that helps people to relearn how to walk again, and it unweights their legs a little bit to give them the opportunity to use their legs again without having to worry about falling and really focus on walking.
With speech therapy in particular, I think people are so individual, and their communication styles before their stroke, their interests, their strengths were so different that once they've had a stroke or once they've had a brain injury, we really need to tap into whatever their strengths and interests are in order to facilitate that improved communication.
One of the things they want you to do is to come to the dining room, to have the social interaction, but also it's a little bit of a boost to know that you're not going to lie there in bed all the time.
Therapy was really good. I graduated from physical therapy and speech therapy.
Here at Adventist Rehabilitation, we have a very simple goal. Our goal is to help you return home as quickly and safely as possible.
Getting people back to life depends on what life for them was before their stroke or their injury.
Does it feel good to be cooking again, Bobby?
Oh, yeah. I thought it would have to depend on other people.
One time we had a patient here who loved to do cake decorating. And so one of her treatment aspects when she got a little bit stronger was to actually try getting her back to doing cake decorating.
And they wanted to be sure I could make the flowers before they let me graduate, and I made them a cake with pretty flowers on it.
One thing that I have found really gratifying about working here is that it's really an environment where we're encouraged to specialize and to further our knowledge in specific areas of therapy so that we can really help our patients get back to life.
Best part about this job is the rewards that you get. With each patient, you can improve their quality of life so that they can go home and have a quality of life and learn to adapt to a new situation. And that is so rewarding.
Each accomplishment has something to do with his everyday life, what he has to do, and where it may just be a physical therapy exercise here, once they come home, it has outward effects.
People here were always very supportive, and they were always looking to see if there was anything that they can do, or there anything that they can help me with, and always looking to give me some type of knowledge or education.
We try to work with our patients to look at the whole person and get them to their highest level of independent functioning.
These people are here to help you to do that. They'll get you back on the right track.
He vuelto a cocinar, que no podía.
I've gone back to cooking when I couldn't. I can bathe myself. I can drive. I can do a lot of things that I couldn't do. For me, that's life.
Para mí es la vida.
The 2 weeks she was here were special. They were just special.
I'm back to life, to everything that I was doing prior to my leg being amputated, and that's because of Adventist Rehab.
Your stay here is not based on days, but on your goals. And each time you achieve those goals, you move forward and towards the day that you'll be discharged. This staff wants to see you return to your life.